Hello, everyone. I'm going to talk about our research currently under development on COVID-19 screening. We are using artificial intelligence method for the screening. This research is done in a collaboration of a lot of people involving our colleagues from the Faculty of Medicine, Universitas Indonesia, together with us at the Tokopedia UI AI Center of Excellence. My name is Adila Krisnadi, and I'm going to be your presenter here. So, our motivation is lies on the fact that we have a pandemic not seen before in our lifetime. We have millions of cases around the world with more than 1,020,000 people have died around the world. Specifically for Indonesia, we have more than 430,000 cases with almost 15,000 people died due to this pandemic, which started in early 2020. Now, the question is then, what can we do about it? Well, the first one of the things that we have to do is we have to do a lot of testing to be able to detect as early as possible the individuals that is exposed with COVID-19 virus. Uh, Unfortunately, there is a bottleneck in the testing because the testing requires, in particular, our PCR or swab test, which may take some time to get. And also, in the case of Indonesia, we have uh, we we need more, or we don't have sufficient capacity in testing using this PCR. So then the alternative is, can we do some screening through other means? So in this case, one of the way to do it is to look at, for example, X-ray images or CT scan images together with the information about symptoms and also other pathological clinical pathology information. Uh, this is used as an alternative. This can be used as an alternative to help us to do early screening better. So how do we achieve that? Well, we achieve that through the use of artificial intelligence. So this is the idea. So the idea is that we uh, use data from the existing X-ray images or CT scan images together with categorical data and numerical data from questionnaire or from information, patient information, or from examinations done on the lab. So we have clinical pathology data, and then also textual information, for example, comments from doctor or notes from the medical specialist, and all of these three types of data are then used to train a deep learning model that allows us to classify whether the given data or the corresponding patient is normal or whether he or she suffers pneumonia condition or specifically pneumonia COVID-19 condition. So if you look at this, the whole idea of this project is to try to create or build an integrated deep learning model that takes into account all of these types of data. This differs from most of the existing models where they only considers medical imaging data. Where do we get the data? Well, for the medical imaging, we have X-ray and CT scan images in thorax area. And these X-ray and CT scan images are annotated by specialists when we want to perform the training. And then hopefully by that, if we have input X-ray or CT scan images, we could classify whether there is a possibility of COVID-19 there. In addition, we have clinical pathology data that includes complete hematology profiles, rapid test screening information if available, and also the RT-PCR COVID-19 confirmation is used to help us training the model. We also use symptom information data, such as whether the patient is in fever, or whether he's or she is coughing, or whether the patient has breathing difficulties, and so on. Also, for example, oxygen desaturation. Now, this data is collected through primary and secondary sources, which includes questionnaires or medical records. And the last type of data that we incorporate in our model is risk factor information. This includes contact history with at-risk individuals or comorbidity conditions. All the data are obtained from patients at the hospital network that is in collaboration with our team. At the moment, the hospitals are located in Jakarta area, and we are planning to extend the collaboration with other hospitals in particular through the Faculty of Medicine's alumni network. All data, of course, is anonymized appropriately, and we went through the ethics committee's clearance in order to be able to acquire data from patients. Now, so the steps that we do, we compare different models in order to get the best results. Here, in this case, the models we use include DenseNet, ResNet, InsertionNet, and VGG16 as well as VGG19, and we also use Dark COVID-Net. So these are all the existing models that we use. But in particular, here we train also the model, or we fine-tune the model on the data that we obtain locally. So most of the pre-trained models available publicly now were trained with data from the US or from Europe or from other sources outside Indonesia. So in order to make it suitable for Indonesia cases, we fine-tune the model with the data coming from locally. So therefore, one of the challenges in this project is to really acquire high volume but also high quality data. The general steps are like this. So from the data, we perform pre-processing, which may include image pre-processing as well as pre-processing for other types of data. And then we, for data such as that is in the form of categorical data, we use embedding. Similarly, for text, we also use pre-processing, and we input them all to deep learning models. We train different deep learning models, and then we combine this into one big integrated deep learning model. The performance so far is promising, but again, this was done with we want more data, because the data we have is not as we still need more data to be able to be sure with the performance. We still have in general, we still have just a little bit of data. So and then what's next? So we built a small prototype demo, and for that we have a separate video illustrating how the demo works. Right, so you've seen the demo. Please note that this is a work in progress. We still need more data, and therefore we expand our collaboration with hospitals throughout Indonesia, and hopefully we get better model in the near future. And that's all. Thank you very much for your attention, and stay safe. Don't forget to put your mask on, and don't forget to wash your hands and keep social distancing. Thank you very much, and bye bye.